I'll have a couple of updates on our progress on our national strategy to defeat COVID-19 at the end of the briefing. But first, let's get a quick CDC report from Dr. Walensky, an update from Dr. Fauci, and Dr. Nunez-Smith, who will talk about the challenges we are facing to improve health equity in the face of this pandemic. Let's start with Dr. Walensky.
Thank you so much. Good morning. I'm glad to be back to share the latest updates on the state of the pandemic. I'll start with an overview of the data. Overall, while we continue to see decreases in COVID-19 cases and new hospital admissions, deaths also continue to rise. Cases remain at elevated levels, so let's start with the cases. Through January 30th, 25.9 million COVID-19 cases have been reported to the CDC. During the week of January 24th to January 30th, the 7-day average of new cases decreased 14.5% to 149,000 cases per day. The 7-day average of new hospital admissions for patients with COVID-19 during the week of January 23rd to January 29th also decreased by 14.6% to 11,800 admissions per day. However, 85,655 people were hospitalized with COVID-19 on January 29th. Through January 30th, 438,035 deaths have been reported to the CDC. During the week of January 24th to January 30th, the 7-day average of deaths increased 2.4% to 3,146 per day. While the recent decline in cases and hospital admissions are encouraging, they are counterbalanced by the stark reality that in January, we recorded the highest number of COVID-19 deaths in any month since the pandemic began, with over 90,000 deaths recorded in January alone. Next, I want to give you an update on COVID-19 variant surveillance. Variants remain a great concern, and we continue to detect them in the United States, with at least 33 jurisdictions reporting 471 variant cases as of January 31st. 467 of these cases are now B.1.1.7 variants, first detected in the UK, and cases of this variant have now been detected in 32 states. 3 of the cases are the B.1.351 variant, first detected in South Africa. 2 states have reported cases of this variant. This includes 1 confirmed case in Maryland over the weekend and 2 confirmed cases from South Carolina last week. CDC has followed up with Maryland to offer technical assistance, including additional case investigation and laboratory support. CDC is also working with the Health Department of South Carolina to provide laboratory support for local contact tracing activities related to the 2 cases there. Finally, there's also 1 case of the P1 variant, the one first detected in Brazil, which has been confirmed in 1 state, Minnesota. CDC is not currently providing technical assistance in this case, but stands ready to assist if the state requests. CDC has been working on multiple fronts to improve our ability to detect and understand these variants. And the recent rise in number of variants detected in the United States is likely due, at least in part, to our expanded ability to sequence virus samples. Since November, state health departments and other public health agencies have been sending virus samples to CDC for sequencing and further analysis. This system, called National SARS-CoV-2 Strain Surveillance, or NS3, continues to be scaled up. We have also established contracts with large commercial lab partners to conduct much of this work. They are currently analyzing 3,000 samples per week and have committed to analyzing 6,000 samples per week by mid-February. As a result of these efforts our throughput of sequences has increased tenfold in the recent weeks, going from 251 sequences that were sequenced during the week of January 10th to 2,238 sequences that were done during the week of January 24th. Additionally, CDC is collaborating with 7 universities that are working with public health agencies to identify variants. And we have provided $15 million in COVID-19 supplemental funding to several health departments in the United States to accelerate the integration of next generation sequencing and bioinformatics into the US public health system. Finally, we are leading a coalition of 200 cross-sector organizations to set standards and share information about SARS-CoV-2 sequence-based surveillance. This is a good start. However, we recognize that more resources and capacity are needed to increase our country's sequencing, surveillance, and outbreak analytics capacity at the levels demanded by this crisis. Overall, this means with the support of these activities, we will now be able to sequence at least 7,000 samples weekly. With cases high and variants emerging, I want to stress to the American people the importance of taking a few simple actions we can all take to protect each other and to stop the spread of COVID-19. First, wear a mask, stay 6 feet apart when you are in public and around others who do not live in your household. Second, please avoid crowds and poorly ventilated areas. Third, now is not the time to travel, but if you must travel, you must wear a mask and follow other CDC and local guidance in order to protect yourself and others while you travel. And finally, please get vaccinated when it's your turn. More than 25 million people have now received at least one dose of the COVID-19 vaccine in the United States, and our latest safety data continue to show that vaccines are safe, with no new safety signals and rates of rare serious adverse events like anaphylaxis comparable to other vaccines. When we take these actions, there is less virus spreading and the conditions that produce variants are decreased. Thank you. I look forward to your questions in a few minutes, and I will now turn it over to Dr. Fauci. Dr. Fauci?
Thank you very much, Dr. Walensky. I'd like to address 3 separate points very briefly, and then we could leave that open for questions and discussions. As you know, last week, with the data that came out from the J&J Janssen vaccine trial, as well as information from the Novavax trial, I think it's important for people to appreciate that we now have the 3 separate vaccine platforms, mRNA, soluble recombinant protein, and viral vectors in the mix right now. Obviously, the J&J will be putting their information into the FDA for an application for an emergency use authorization. The reason I bring this up is that as these things roll out, they will have different degrees of what's called point vaccine efficacy. So we know that we had a 72% overall efficacy in the United States for the J&J. But important to point out when people ask about the difference between 72 and 94, 95 with the Moderna and the Pfizer, is the fact that when you look at serious disease, hospitalizations, and death, it has had a profound effect on that. So as we get into the next weeks and months and more vaccines come out, there may be different, there'll be common use of them in the big pool of vaccines, not only for the United States, but worldwide, but there may be some advantages that you might see with one versus the other. For example, the idea of a single dose, the lack of a very strict cold chain, as well as the availability of having a large number of doses. So I just bring that to your attention. Now, Dr. Walensky mentioned the issue of variants, and there's a real relationship now between the vaccines that have already been given an EUA, those that will get an EUA, and how we address the variants. When the variants were first recognized in South Africa and in the UK and in Brazil, one of the important things that one does is take serum from individuals who have been vaccinated with the available vaccines and see how well they do against the variants. What became clear is that with regard to the variant, namely the 117, that was a variant that was predominant in the UK, there was very little impact on that. And actually, that was shown by the Novavax study, which was done in the UK when they had a 90% efficacy, and the dominant variant there was the 117. So you would expect that it reflected what you would see. But we do know that antigenic variation does have clinical consequences, because when you looked at the South African isolates, namely the 351, that one had a multifold diminution in the efficacy of antibodies induced by various vaccines that are in use now, but it was still within the cushion level of providing some protection. The reason that was important is that that was reflected in the J&J trial. So we're learning not only that we have more vaccines, but we're learning about the virus and how it interacts with our ability to protect with vaccines. Because when you look at advanced disease, hospitalizations and deaths, there was a profoundly positive effect by the vaccine, even though the effect numerically was diminished. So, for example, there was about virtually no hospitalizations or deaths in there. Now, getting to the third point, which I believe is important and relates to what Dr. Walensky said, that it is important, even when you have a variant circulating in which you may not have a 95% efficacy to prevent infection, it is very important that you might very, very positively prevent serious illness and serious disease. We've been asked questions often. Well, if you have these variants and they seem to be eluding the vaccine a little, should we really be getting vaccines, or should we wait for the next generation of vaccines? The answer is you need to get vaccinated when it becomes available as quickly and as expeditiously as possible throughout the country. And the reason for that is that there is a fact that permeates virology, and that is that viruses cannot mutate if they don't replicate. And if you stop their replication by vaccinating widely and not giving the virus an open playing field to continue to respond to the pressures that you put on it, you will not get mutations. So when we're looking at what we have here in the United States, as well as globally, when we talk about efficiently and getting these vaccines out there and into people as quickly as we possibly can, not only are you going to protect individuals from getting disease, not only are you going to protect them from getting infected, but you are going to prevent the emergence of variants here in our country. And when you look at the global situation, which is the reason why we want to make sure we're part of a global community, and we recently have joined the COVAX, which is a consortium to get people vaccinated throughout the world, is that the only way we're going to completely stop mutants is if we stop this throughout the world. So again, Dr. Walensky gave you the 4 or 5 things you need to do to protect yourselves. I want to emphasize the last thing she said, which is very important. When the vaccine becomes available to you, please get vaccinated. So I'll stop there and hand it over to Dr. Nunez-Smith.
Hey, did you know we have a video podcast called WJ Live?
The Western Journal's mission is to equip readers with the truth. That's the exact same mission we have on WJ Live.
You'll hear from writers, editors, and special guests on the most important topics of the day.
You can watch it live every day at 5 p.m. Eastern, 2 p.m. Pacific at youtube.com/WJ Live.
While you're there, help us out by subscribing and hitting the bell so you won't miss out on any future episodes.